I think we're all here really because we understand bringing government, private sector, NGOs, and individuals is important to the progression for sickle cell disease response. Historically, this genetic disease has been called the silent disease because of low levels of awareness. It's usually underfunded and overlooked. And that's what we're also going to be discussing further in the webinar with our keynote speakers.
So what exactly is the problem when one carries the double gene? The normal red blood cell is usually a round-shaped cell, like a donut, which you see on your right-hand side of the slide. And this one moves very well within the blood vessels. But when this mutation occurs in a double format, under oxygen tension, this round shape of the red blood cell is lost, and then you have the sickled shape, the crescent shape on your left-hand side. And that particular shape doesn't move readily within the small blood vessels, and it tends to cling on each other, causing blockage to blood flow. And most of the clinical phenotypes come out of this deformed form. This deformed red blood cell usually doesn't have a long shelf life. It gets destroyed it has a short shelf life of just 3 weeks when the normal cell has about 4 months. So it is destroyed quickly and it results in a lot of anemia.
Now, you could say, looking at the demographics, it's predominantly, as we know, in people whose family originates from Africa, the Caribbean, Asian, and the Mediterranean. But certainly back in with our Windrush generations, the 50s, 60s and 70s, and migration, we have currently approximately 15,000 people in the UK who have full-blown sickle cell disorder. So although it's a drop in the ocean, when we compare that to approximately 2 million worldwide, our healthcare system is a system which is healthcare for all. We recognise that actually this community was not getting the treatments that was possibly available, or even those that weren't available, and because so little was known about the condition.
Within our team at CTI, our Life Health Network team, we recognized that under COVID, getting to the doctor was clearly a lot more difficult than it was before. So the demand and the need for using telemedicine became even more apparent. And again, as we were understanding the life of the people with sickle cell more, it became even more apparent that this segment of the community is going to be able to benefit far more from having the ability to use their phone to be able to communicate with their doctors. But most importantly, we are going to be launching a registry. And with this registry, we want all people to be able to be tested. And that way, before they get married or commit to have children, it's a very easy test to be able to see if somebody's compatible or not compatible. You know, we are here, we are committed. I gave a personal donation, which you guys can go and check on our website to see how much I gave personally. But now I'm committing to an additional $10,000 from CTI to kick off the corporate side of the campaign. And we welcome and encourage everybody, certainly on this call and beyond, to make this an international cause. And if people can come up with the Sickle Cell Challenge, so let's get behind this campaign and let's make history and let's eradicate sickle cell once and for all.
A little bit of Uganda Sickle Cell Rescue Foundation. We started in 2013 by one Dr. Blame Mwanga Chibidige and a US major called Lukia Mulumba. She's a US major in the US Army. She's called Major Lukia Mulumba. And they started this organization to help sickle cell warriors around the world. And our goal is to improve the general quality of life of people living with sickle cells. And this, I was saying, our goal is to improve the general quality of life of people living with sickle cell disease and we are doing this through sensitizations. We have objectives like screening and testing. We have we do free screening testing, we do counseling, we do education and awareness, we do networking with the governmental and non-governmental organization. So those are some of the services that we provide.
You know, I've gone through situations where housing officers looked at me and said, but you're a finance officer for One Born Rich. You're telling us you can't work. You're telling us you're in pain, but we're looking at you. You look well to us. You're walking perfectly fine. That's the lack of understanding. You know, we go to the hospital, you know, the ambulance comes and gets you, and the paramedics will make comments
like,
you know,
you're here for the medication. She's only here for the morphine. Like, I have morphine in my house. I don't need to go to hospital for the morphine, as they say.
And when I'm touching, that's the stigma that's in the NHS, and that has to be tackled immediately, because that's where we go for help. These are the people that have our lives in their hands. They're the ones making decisions for us. So if I'm signing up to a GP just in Romford and the GP says to me, so when did you get sickle cells? I'm scared and I'm worried. Is my health in the right hands, you know? And we need to do more.
There was this big campaign about Black people, the Black community, to register as being donors. And I said, what are they talking about? To somebody, it's like, what's all this about? I didn't know anything about it. Anyway, reluctantly put my name to be a donor on the donor register. And unknown to me that is going to be hitting back home. So when my friend found I need a donor, I contacted the SOT, those Afro-Caribbean Kenya Trust, and explained that my friend desperately need a donor. And you know the first thing they told me? Go and tell the family to put their names on register and ask all the family members, immediate family members, to be on register of being donors. And that was the first challenge. Find the family and also to speak the community and say, you know what, we need to be on register so that we can get a lifeline for someone. And that was the biggest challenge of how do we get someone to get a donor.
In a nutshell, Life Health Network is really a digital platform for healthcare services. We have many arms, but I'll focus on the four that I think are really pertinent to our warriors. So really, as mentioned earlier, the four arms I'm going to focus on, the CTC, that's called the clinic that provides medical consultation services for doctors and specialists. It will be a very good platform to avoid unnecessary visits to the healthcare facility. The other arm that we have is the Life Health Wallet. This provides a medical record on your phone, which you can carry with you all the time, anywhere you go. And the last one, which we are all here for the drive for sickle cell, is the Life Mobile Phone. The beauty about the Life Mobile Phone is it already has all these apps installed.
Just because we're sickle cell patients doesn't mean that we're silent in the conversation when it comes to sickle cell disease. So we advocated for the fact that sickle cell patients, 9 out of 10 times, even though doctors can actually read about the symptoms of sickle cell, 9 out of 10 times it's the patients that actually live through these experiences that need to tell their stories, that need their experiences being told. And we basically, from that aspect, we just made it clear that it's okay for fellow sickle cell warriors to have a voice in regards to the sickle cell conversations. And if we don't have a voice, then how can that conversation move on? And that's why we basically advocated a platform to have fellow sickle cell warriors to speak out, talk about their experiences, and also change the perception of sickle cell in general. So we didn't want it focused on sickle cell patients being in hospital. It had to be focused on the daily experiences of sickle cell patients in general.
And concluding with that, it's been great to have each and every one of you on this panel, from NGOs to government to private sector, each really giving us your take on how we should be going on and how we should be focused on the sickle cell disease response. We brought up a lot of key points from awareness, from partnering together, sharing best practices. So thank you all very much.